Heads up.
Heads up.
Heads up. Good afternoon. We wanted to come today before you all and the American people to show just what kind of a shell game is going on around here. Earlier today, the Speaker herself said that they plan on passing the so-called doc fix. That means at least $210 billion of new spending in Medicare to prevent this cut from hitting physicians by 21% this year. Well, if that's true, then all of these claims of deficit reduction ring hollow. That bill alone wipes out the claims of deficit reduction in this bill. So while the Democrats are trying to claim $522 billion of cuts from the Medicare program to pay for a new entitlement, they're ignoring all of this doc fix spending that they plan on passing in separate legislation this year. I would simply say that hiding spending does not reduce spending. Ignoring this piece of legislation today does not take it off the backs of taxpayers. So for all of the bells and whistles and all the hoopla and all the press conferences about this being an act of fiscal responsibility, of this bending the curve and reducing the deficit, we all now know that that is completely false. This bill is a budget Frankenstein. It is a house of cards. It is going to give us a huge deficit now and an even larger deficit in the future. And we can very clearly map this out, yes, using CBO numbers. And with that, I'd like to turn it over to our leader, the whip, Mr. Cantor.
Thanks, Paul. Clearly, Paul has laid out for days, for weeks, along with Dave, the budget trickery involved with this bill. CBO's estimate is just not accurate. I mean, listen, if they can go about, and the Democratic majority can go about assuming this kind of fiscal state, one really has to question how it is we're going to see the course for our future charted in any responsible way. And this kind of trickery that is involved with this really, I think, has now manifested itself in their difficulty in getting the votes. I mean, we're here right now, and we know they don't have the votes for this bill. And, you know, listen, it's very straightforward. We know that we need 38 Democrat no votes in order to defeat this bill. Publicly right now, there are 33 stated no votes on the Democrat side. We also know that there are 12 members of the so-called Stupak group that are standing firm against the attempt to allow for government funding of abortion. And we also know if you add that 12 to the already 33 Democrat no votes, there's no way they can pass this bill. But we also know that there are many other swing districts on the Democratic side of the aisle that are in play. So we are fighting hard to make sure we're doing everything we can to fight this bill. And again, this type of fiscal chicanery does not give the public a lot of confidence in what the Democrats are about.
Thank you. Dave Camp from Michigan. They're hiding the true cost of this bill, and they're hiding the impact this legislation will have on the deficit. As you've heard, by not including the so-called doc fix, as the Speaker this morning promised that she would do, they also include the Class Act, which is long-term care insurance, and say that that actually reduces the deficit by $70 billion. Now, that new entitlement is something Senator Kent Conrad called a Ponzi scheme. And everyone knows that that new entitlement over the long term will increase the size of the deficit. So if you simply take those two things, the so-called doc fix and the long-term care insurance entitlement, and put those in the bill as we know they are going to do, the bill actually increases the deficit by nearly $150 billion. They're hiding the cost of this bill. They're hiding the fact that this bill will actually increase the deficit for all Americans.
Questions?
I just want to make sure that I wanted to clarify. I know that several Republican leaders have said that all the Republicans are going to vote against this bill, but there's been talk recently, I guess, among the folks in Stupak's 12 of coming up with some sort of concurrent resolution. Are you sure that Joseph Gao is going to vote against this?
Yes, I have spoken to Joseph Gao as recently as an hour and a half ago. He is a firm no against this bill.
I heard your staff out there talking about how you'd get asked about the authenticity of this memo, but I'm going to ask it anyway. obviously, the memo that went out from the leadership from Boehner's office earlier, Democrats are now saying that was a hoax and that it's a dirty trick. Can you guys vouch for the authenticity of the memo?
Look, the appropriate question there really is ask the reporter who wrote the article alleging that it was a hoax. I know nothing more than what I read in Politico. I think the question that you really ought to be asking is the hoax on the American people presented by the budget assumptions made on this bill.
And that's the point. I mean, just go to the subject of who cares about a memo. The point is the Speaker is telling us she's going to do the doc fix. So that means that's part of this. That means it's part of health care spending this year. That means all of this claim of deficit reduction is false. That means this effort will increase the deficit. You can't count a rate of $522 billion from Medicare to pay for this new entitlement and not count at least $210 billion of spending in Medicare for the doc fix. The numbers just don't add up. And so all of these claims that they've got this great new effort at fiscal responsibility completely ring hollow when you actually look at reality and the facts. There's different numbers. The administration's number is $371 billion. The House bill that was on the floor earlier was $210 billion. Either number you choose, it wipes out the claim of deficit reduction.
Does this call into question anything with the CBO, or is this just the
No,
Democrat?
let me be clear about that. The people at CBO are good people, really hardworking people, doing their jobs. The problem here is you can manipulate legislation to predetermine the score you're going to get from CBO. CBO has no choice but to score what you put in front of them. And if you put in front of them a bill that double counts money, that discounts spending, then that's what they score. If you put in front of them a bill that doesn't have the doc fix in it, they don't score the doc fix in it. If you put in front of them a bill that gives you Class Act premiums and they spend that money, that's how they score it. So they don't have a choice but to score what you put in front of them. And if you manipulate what you put in front of them, you'll get a manipulated score.
Yeah, I often put it this way. It kind of reminds me of my high school physics class, where in physics they tell you first assume there's no gravity. Well, they first assume that they're not going to do a doc fix, which we know the Speaker has said they will do. We also know that the long-term care entitlement will not reduce the deficit over the long term. It will add to the deficit. And if you add those two together, this bill increases the deficit. And so what we're saying is, given the framework CBO was asked to work in, we're not questioning what they came up with, but we have to look at the realistic framework, the reality that's going to face the American taxpayer. And the reality that faces the American taxpayer is the deficit's going to go up.
Is there also a possibility, there's an argument out there, I wonder if you could speak to it, that the bill, excluding doc fix for a minute, could reduce the deficit by the number they've stated, 138, and yet add to the debt through borrowing money?
Well, that's right. Even using their CBO cooked number, it will add to the debt because it's all about the trajectory. You're running up big deficits in the first years, and then you don't turn the corner on debt on the deficit until the end. So you will have deficits occur under this law, interest compounding on that, and that gives you a bigger debt number even though they have a claim of deficit reduction. So that's actually true. So when you strip out the double counting, add in the doc fix, not only is it a big deficit, it's a massive debt burden that is incurred under this.
Devil's advocate for a second.
You always do, Jonathan. I wouldn't expect anything else.
Sorry. But they would argue that they're going to come closer to paying for it than you guys did in 2004 with Part D. I mean, is that a comparable question?
That was a program this big compared to an entire takeover of the healthcare system. And look at what was done in Part D. Introduced the choice and competition, introduced free market competition, and that bill came under 40% below cost projections. Name me another program that's ever done that. That was one part of a benefit for one program. This is an entirely different situation where they're having a takeover of our entire healthcare sector, 17% of our economy.
Well, and let's remember the context back then. Their Part D cost 2.5 times what the version that eventually was enacted into the law would have cost. So if they'd had their way, Part D would have been vastly more expensive than it is now, and without the private sector components that Paul mentioned, it wouldn't have been driven. They also mandated a premium that is much higher than the average premium is today.
Obviously, the Democrats didn't create the SGR that the doc fix would fix. So I'm just wondering if you can address concerns that it's perhaps not fair to lump in that with the healthcare overhaul. And secondly, I also wanted to ask you, they've gone to great lengths to try to scrub this of things that might be subject to the Byrd rule. Do you think they've succeeded, and what are some things that might remain subject to challenge?
Yeah, I'm not sure I'm going to apply for the parliamentarian of the Senate job, but let me just say on the doc fix, we offered a paid-for doc fix for 2 years that gave them a 2% update that the Democrats blocked on the floor. So we addressed this problem in a responsible way, and it was fully paid for, and they didn't let it come forward. So I think it is absolutely correct to bring this issue into play in health care reform because we all know that we need to do it, and it is going to happen, and it is going to impact Medicare spending.
I mean, the origin of the policy is immaterial to this conversation. That was the latest version of the SGR was something President Clinton signed into law. So if we want to say who did what, that really doesn't matter. It exists.